PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome, and PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep Infections. So PANS is kind of an umbrella. PANDAS is a specific diagnosis underneath that umbrella of PANS. And the reason I say this is they have very similar onset, very similar symptoms. It's just that PANDAS is clearly identified and associated with strep, and PANS is a collection of symptoms that we call a syndrome that could have multiple different origins with the same general belief for what the underlying mechanism of action is, and it's still being researched to really fully understand. With PANS or PANDAS, a lot of times the most stereotypical presentation is that there's a rapid onset of sudden OCD and tics, behavioral changes after an infection. The challenge is this doesn't happen in most of the cases, like 60% of the cases. It's not a clear infection with a sudden onset of symptoms, and specifically OCD and tics. A lot of people, it can actually be a waxing and waning type of thing where they see symptoms that come up behaviorally throughout a child's life that are dismissed as something that's transient or something that will pass without any intervention. A lot of pediatricians will say this about tics or unusual behaviors. And some of it's true because there are developmental stages that could look like obsessions or compulsions when it's really just a child learning a new skill and wanting to do it again and again and again because they're excited about that new skill. So sometimes we can have something come on where it looks like it's been building over time and then they're just sort of stuck in it.